Starting off, I know you kind of mentioned that you've read a lot of context articles and assigned them. Why did you want to publish your ideas with contexts?
Personally, so I wanted to publish with Context because it's a journal that I think really does storytelling justice. And so when I was doing my field work for this paper, I heard really rich, complex stories from Black mothers about how Child Protective Services involvement really turned their lives upside down. And then as I prepared manuscripts, I saw firsthand, really for the first time, how these rich narratives are condensed and stripped of some of their complexity and really boiled down into more traditional academic journal articles. But then I'd read and taught enough context articles to know that sort of the pulse or the meat and bones of context articles is really accessible storytelling. And so that really appealed to me.
Could you walk us through the main argument of your article and what would be the one key takeaway you would want readers to leave it with?
The main argument of our article is that fear of having children removed from their custody shapes how Black mothers interact with the US healthcare system, specifically maternity and pediatric care. Really, the main takeaway from our article is it's similar to Kelly Fong's argument, and it's that fear of something, like fear of children being taken away, has consequences for how groups navigate institutions, but also where they navigate institutions and the types of institutions that they navigate.
How do you think these main ideas about this affective dimension of engaging with the medical system, how do you think these ideas are relevant to the broader public?
I think people who are interested in the impact of Child Protective Services would be really interested in this article. There's a growing Child Protective Services abolition movement that's been building. And so I think those folks would be really interested in this work because it speaks to sort of the lasting impact of Child Protective Services reports. And then I think it would also be interesting to folks who are invested in reproductive justice and Black women and children's health outcomes. So my co-author, Alexus, studies reproductive health disparities among Black birthing people. And so she really pushed this article to speak to that audience as well.